Hi, everyone. I'm Mari Cockrell, Communications Director for the City of Abilene, and here with Annette Lerma, our Health Services Director for the city as well. Wanted to be on here today to talk through the new numbers for Taylor County. As you may have seen, our number has gone down to 206 for COVID positive cases. And there's a reason why this has dropped all of a sudden, so we want to just talk through that. And basically, the state has notified the health district of two groups that we need to take out of our total number. So Annette, I'll let you kind of talk through that, the conversation you had this morning and the changes that have been made.
So I got a call from our Associate Commissioner of Health for Texas, Dave Gruber, and he just talked about the need to kind of be consistent across the state with how they were defining a lab confirmed case. And so previously there wasn't any CDC guidance about how you should or should not use serological testing, or guidance from the state to say you should or should not include them in your positive results. So we had known that there was some conversations going on about some guidance that was potentially coming down. And so today they did verify that for us, that we needed to remove those serological tests, the positives, from our PCR positive tests. So it's just pulling those out and only reporting our lab confirmed PCR test positives.
And so up until this point, there's the two tests. There's the PCR, like you noticed, that's the swab, the one that goes way up in the nose. And then there had been the serological or the antibody test. And so those two tests were happening. And if as either of those came in positive, they went into our positive count. But we're finding out that a lot of other places, and now the state has directed us as well, other places haven't been counting those antibody tests, and we have been. Some others may have been as well, but either way, to make this reporting more seamless here and make sense apples to apples, right? Taking out the antibody tests.
Right, and he did clarify also that he was not saying that they could not be used as a screening tool. I know that there is some discussions, especially in the clinical world, about are these tests valid? How should you use them? And we're certainly not intending to use them for clinical diagnosis and refer on for treatment. So we're using them as a screening tool for public health to determine what's the best course of action. Do we isolate this person based on that positive serological test? And so our medical director kind of takes into that her clinical judgment to say, do I feel like this person is a risk? Are they symptomatic? And we were erring on the side of caution and going ahead and isolating those positive cases as well. So.
And so for the number that we had of total cases today, we're subtracting now what had been 82 of these tests that had been just these antibody tests. And then there's a second group that we needed to go ahead and not count in Taylor County, and that was the inmates at the Middleton and French Robertson units. That's accounting for 94. So that's where we're getting to today's 206. It's the 94 and the 82 taken out. And so again, as people will know, you were explaining how those prison units, they're considered Abilene as an address, but they're in Jones County. So those numbers actually, then those 94 inmates need to go to being Jones County cases.
Right, so those will get reported officially in Jones County and be attributed to them. So that really was just kind of an honest mistake in terms of data entry. So as those are entered into the spreadsheet, we have a GIS person within the city who goes in daily and kind of filters all of those addresses to make sure that we're not reporting positives that are outside of our jurisdiction, so we can get those kind of turned over. And what we discovered was that the people who are entering those into the spreadsheets are just putting either French Robertson unit or Middleton unit rather than an actual address. So GIS was not going in and filtering those out. So like you said, they've got an Abilene address. And so just by looking at them, they look like they belong to Taylor County because they're within Abilene. But they actually lie in Jones County. And so we will go back in and back all of those off and make sure that they get reported in the Jones County jurisdiction.
Gotcha. And so again, today's 206 number, and if folks are able to read the news release that we have posted with links to on social media, but also just directly on abilenetax.gov, it's basically taking today's total positive cases, subtracting the 94, subtracting the 82, we get to 206, and moving forward, we'll be building off of that 206. And
right. So moving forward, we're still going to be using the serological test just as a screening tool, but we are going to follow each of those up with a PCR test to just confirm that it's a positive, and we will only report to the state those positive PCR tests.
Right. And just if anything, like you said, in all of this, I guess the over-reporting a little bit of what could be positive cases, like you guys, erring on the side of caution, and just wanting to also remind folks about demographic information as well. We have the kind of simplified graphic up today, just because now your staff will be going through all of this data we have and redistributing for age and transmission type and all that to where they belong. So it'll be a few days before we'll be able to get all that demographic information back up. But of course, we plan to do so as soon as we've got it straightened out.
Right. So there's a couple of different spreadsheets that they manage all those on, and we still do track kind of everybody who's tested here within the city limits of Abilene. Those tests still get reported to us, and so we know about those positives even if they're outside of jurisdiction. But those are kind of managed on a separate spreadsheet. So we can kind of keep track of what we've done and what we know about, but we're reporting demographic information of those that belong in Taylor County. So it will take a little bit of time to just tediously kind of go in and make sure that you're getting those moved over to the right spreadsheet and that your formulas and everything still kind of work and are still populating to the same totals and all of that. So it's a little bit more complicated than just math. I know that sometimes it's hard to understand when you don't see all the processes that go on. It sounds like a simple thing, but it's a tedious process, and someone has to go in and manually remove and move them over.
Yes. Okay, so look there at our number, and I know also you just want to remind folks, while our number is lower, please stay vigilant in all that we're doing, because it's been working. Our hospitals have not been overrun, and no matter where these cases lie, whether it be Jones County or not, we want to continue to ensure we have resources available.
That's right. And so just keeping in mind that even though we removed those 94 cases from our number, we've still got prison guards and staff that are going into those prisons. Many of them do live in our communities. And so there's still a risk from that, even though the numbers aren't there, but there still is a significant risk to the community just based on those numbers.
Gotcha. Well, thank you, Annette. Of course, if folks have questions, please do, post here, and we'll try and get to them as best as we can. And just wanted to give a little bit more insight into where we're getting this new number today, as we know that will probably bring concern for a lot of people. So thank you again, Annette.
Sure. Thank you.